While Professor Mosa Moshabela says that the country may be entering the fifth wave of COVID-19 infections, but he says that there's no need to panic just yet.
On the one hand, we have to look at what government needs to do, and then on the other hand, we need to look at what we can do as South Africans. I think government is certainly going to look at the numbers of admissions and deaths, and also to see whether severe disease is going to kind of impact on the health system in any way. They are going to try and aim at ensuring that the health system is resilient and protected and it does not collapse. And with what we are seeing at the moment, we are not really seeing an increased pressure on the health system, even though the number of admissions is rising. So we can then expect that government will do its part to take care of that aspect. But I think really the biggest burden is going to be on us as South Africans in the population. Most people are going to have infections that are not necessarily going to end up in hospital, but all of those infections can in many ways sort of, end up becoming long COVID, can end up sort of making it difficult for people to go to work. And it may end up, spreading to people with vulnerabilities. And I think we have to take it upon ourselves to make sure that we protect those among us who are vulnerable. And we also make sure that we limit chances of infection in order to avoid the burden of long COVID and other complications of COVID.